Lipedema 101. This is for those of you who are new, all right? And I saw yesterday how many hands went up when Cheyenne asked if this was your first conference. So, welcome to our tribe, all right? I have nothing to disclose. Wrong button. There we go. I have nothing to disclose. So, can you turn this little monitor on down here so I can see what I'm talking about? So my story, I'm 59 right now. I self-diagnosed myself, which is redundant, I know, but in 2013, so a little more than 10 years ago. And I had the incredible good luck of figuring this out, thank you, figuring this out just in time to join the Lipedema Sisters USA Facebook group and go to the gathering that they had in Tucson that year. And there I met Dr. Herbst, and I met a whole bunch of other wonderful people. And I learned that liposuction was a reasonable way to treat lipedema. So I went to Germany the next year, the following winter. I guess January was the first time. And back then, there were a grand total of 0 surgeons in the United States treating lipedema with liposuction. So my choices were Germany, Germany, and Germany. And so I had liposuction with Dr. Stutz, and it made such an impact on my quality of life that I came back all energized and motivated to make awareness of the disease and the options for it possible in the United States. So I ended up joining the FDRS board in 2015, and it's kind of like the Hotel California. Once you check in, you can't leave. So I'm still here. It was 10 years ago this month that I had my second surgery in Germany, so it's kind of a big anniversary for me. Let me give you a little bit of background about lipedema. This is going to be not a deep dive at all. This is just sticking a toe in and giving new people some background about lipedema. Other speakers later today will be diving much more deeply than I will. So first described in the 40s by Dr. Allen and Hines. They were vascular surgeons at the Mayo Clinic. And in 1951, Dr. Wold, along with Allen and Hines, described they codified some criteria for it. It is not a rare disease, but it is rarely diagnosed, although that has changed so much in the last 10 years. I cannot begin to touch on how wonderful this is. And I want to stress that this is not a new disease. Okay, these two pictures here, the lady on the left is Queen Adi of Punt. Punt is where modern-day Eritrea is, so it's along the northern part of the Horn of Africa. And that's from 3,400 years ago. And if you look at this lady, you can see she has some typical lipedema signs, which I will get into later. And the one on the right, that's the Venus of Dolní Věstonice, which is part of the Czech Republic now. It's the oldest piece of fired clay pottery that we have found so far in the world, and that's from 27,000 years ago. And that's a period of time known as the Paleolithic, when everyone ate paleo. So I want to stress that even if you're perfect with your diet and your lifestyle, and I mean, these were hunter-gatherer people, they were doing a lot of walking, you can still get lipedema. Okay, so what is lipedema? It is, as Cheyenne alluded to yesterday, right now, here in the US at least, we're considering it a disease of loose connective tissue, of which fat is a type. Okay, so it appears predominantly in women. There are a few documented cases of men, but not many. And it is most characterized by a disproportionate accumulation of subcutaneous adipose tissue in the lower body, the hips, the buttocks, the lower legs, and the arms. And that tissue usually does become very nodular, and I'll get into that in a minute, and fibrotic. And it tends to show up at times of hormonal change in women. And we have a lot of symptoms. That tissue bruises really easily. A lot of people report that they look down in the shower and they see a great big black and blue mark and they have no idea where they got it. Well, it could be that their cat jumped on their lap, you know. Diet, exercise, bariatric surgery, all the things that are supposed to fix being overweight don't work that well with lipedema, though there is some evidence that for some people, certain eating plans do work, and there'll be more on that later today. Comorbidities that can happen with it, you can develop a secondary lymphedema, you can develop obesity as well, so can anyone really, venous disease, back pain from the way it alters your posture and so forth, and hypermobile joints is very common, knee problems, so forth. And the associated pain and disability that you can get from this can really mess up your mind. And women with lipedema have a much higher incidence of depression, eating disorders, anxiety, poor self-worth, and so forth. So currently it's divided into 3 stages. They're mostly determined by the skin changes that occur. So when you're stage 1, your skin is flat, it's smooth. You might have a little bit of dimpling, but you can generally feel areas of fibrosis, especially on your arm. It'll have a texture underneath the skin of like little grains of rice or maybe split peas or something like that. And usually it's not that disabling, but it can be. Stage 2, you develop these larger dimples here, and the fibrosis becomes more apparent. You can develop like lipomas, which are small nodules of fat, and your skin can start to hang off. If you've noticed, people can have hanging flaps of skin down here and so forth. And still, usually, if there is an edema, a fluid in the skin, it'll resolve by the end of the day, but often not as much. And then stage 3, numerous large nodules, very prominent, very obvious. You can develop a cuff at the ankle or the wrist, and you start to become much more hardened and fibrotic. Okay, now we used to call stage 4, we used to call it stage 4 when someone with lipedema developed a secondary lymphedema. Now we just call it lipolymphedema or lipedema with secondary lymphedema. And that's when it has progressed to the point where you have noticeable lymphedema component. And other folks are going to go into a much much deeper dive into the differential diagnosis of those. So types of lipedema, it just depends on where in your body it has developed. Karen Herbst can probably tell us the proportions among the different types, but now that I put her on the spot, she's giving me a look. And most people are a mix. You know, you're not going to be just a type 1. You might be a type 1 and a type 4. But the really important takeaway is that stage and type have absolutely no correlation to the amount of pain that the patient experiences. So a slender type 1 who just has some very localized deposits could be hurting much more than someone who appears to be much more affected. Differential diagnosis, obesity, the tough part for a lot of clinicians is that BMI is so much, it's dogma in this country about the implications for your health and so forth. Somebody with lipedema can have a sky-high BMI, but still be metabolically healthy. You don't have high blood pressure, your lipids are fine, your sugar is fine, and so forth. And people with lipedema, yes, they can be obese or overweight, but you know, so can a lot of people. 70% of Americans are obese or overweight, and so why can't people with lipedema also be that way? Some people confuse lipedema, a lot of doctors confuse lipedema with lymphedema, but they are distinct diseases. They're related but distinct. And Dr. Wright and Dr. Pennings and other folks are going to go much more into detail in this. So what causes lipedema? The short answer is we don't know. And I put yet there because I want to give a shout out to all the researchers that are in the room, especially the Lipedema Foundation. Where we are now versus where we were 10 years ago just boggles my mind. I wake up every morning and say, wow, it's so good now, and it's just going to get better. It's probably multifactorial. It runs in families, so there's probably a genetic influence, but it's not a particular gene that we can point to yet. It's probably multiple genes, and the more of them you have, that may increase your likelihood of developing it, your predisposition to it. It primarily occurs in women, so there's probably a hormonal component that is affecting it. And it's also associated with or exacerbated with inflammation. So that almost certainly plays a part. And there may or may not be some lymphatic involvement. They don't know if the lymphatic problems come first and cause the lipedema, or if the lipedema causes the lymphatic involvement, or along with the inflammation, it's some sort of vicious cycle that just feeds on itself. We don't yet have a decisive biomarker. Like if you have diabetes, it's pretty easy to tell. You can tell you have elevated blood sugar, right? But that's not the case with lipedema. So the diagnosis is based on a clinical exam, and I am not in a position right here to give you a whole thing about clinical exams and how to diagnose. Other doctors will do that. The abysmal lack of awareness about lipedema relates in delayed diagnosis for many people. Most people aren't diagnosed until early middle age, even though when do the symptoms appear? Often at puberty or pregnancy. So many people have this disease for many years before they know about it. And if you don't know you have it, you can't treat it. I'm going to say, to paraphrase Dr. King, I'm going to say diagnosis delayed is diagnosis denied. That means that people can develop much more severe disease than they would have had they known what to do earlier. And so and that is a typo there, I'm sorry, resources are available for clinicians unfamiliar with lipedema. I gotta love spell check, you know? All right, so the resources that are out there are much more than they were. Standard of care for lipedema, I am so honored to have been part of the committee that developed this. It happened, thank you. I was a small part. Karen Herbst led the thing along with 20-some other people, and we met at one of the FDRS conferences to kick it off, and it was just a really wonderful experience. Okay, I'm getting the axe. So these are things you can do. You can look at the standard of care, which is available on the internet. The LF gives us, they just produced this clinician's guide, which is incredibly helpful. They have lots of copies of them. And treatment is not a cure. It just helps to prevent progression, improve your mobility, improve the symptoms, and so forth. You can do conservative and surgical, and there'll be many presentations about all of those today. And here is our lipedema treatment butterfly. This is from the FDRS. You can find it on our website. It gives you can't obviously read it, so look for it there. Enjoy the conference and go learn things, okay? That's why you're here. Thank you.